When Nima Bhakta, a 31-year-old South Asian woman from Southern California, was found to have died by suicide months after giving birth to her baby boy, an unsent draft on her phone read as follows. It was something you guys wouldn't understand because Indian society does not fully understand postpartum depression. As Nima so clearly noted in these words, she was aware of her postpartum depression, but there were cultural factors presenting in her path to receiving the help she needed. Losses such as this one are tragic, but preventable if signs of postpartum depression are caught early and efforts are made to eliminate social and cultural barriers to seeking treatment. My name is Prasida Unni, and I am a third-year medical student at Boston University. I, along with my colleagues Yamini, Anvita, and Dr. Nidhi Lal, are excited to share with you our project inspired by Nima's story and the strive for supporting individuals in the South Asian community who have postpartum depression. Here we present Dance as a Storytelling Medium, Integrating Cultural Perspectives into Medical Education. Postpartum depression, or PPD, is defined by the DSM-5 as a mood disorder involving the occurrence of a depressive episode in a birth giver within 12 months of childbirth. 1 in 7 women can experience PPD, and symptoms include depressed mood, feelings of worthlessness or guilt, recurrent thoughts of death, and suicidal ideation or attempt. Although PPD is a well-known condition, literature reveals that the ability for healthcare providers to identify PPD symptoms is often inadequate. Even when patients do screen positive for PPD, there are significant discrepancies between those who screen positive and those who ultimately seek treatment. There are many communities which are found to be at a higher risk for having PPD symptoms, with the South Asian community being one of them. South Asian immigrant women living abroad are at a twofold increased risk of developing PPD compared to women living in their country of origin. Some cultural factors which have been identified as contributing to this higher risk include cultural stigma surrounding open discussions about PPD, as well as a general hesitancy in the South Asian community to discuss mental health with healthcare providers and even within their own support systems. Evidently, when considering the risk factors for PPD, it is important to acknowledge the social and community context of this illness. Social and community context is one of 5 social determinants of health identified by the Centers for Disease Control and Prevention. Recent data from the U.S. Department of Health and Human Services reports a decline in the proportion of adults who report having social support, and so social and community context has been identified as a determinant of health for which the United States is currently falling below target. In order to encourage those in the South Asian community to seek help for PPD, efforts need to be made within the community as well as from the side of healthcare providers. In the community, we need to destigmatize PPD and increase awareness about the resources to seek help and support. From the provider side, we need to better identify signs and symptoms of PPD while acknowledging the cultural context of stigma so that we can better recognize the nuances in the presentation of PPD. In fact, in order to address the cultural context of PPD, it is the responsibility of providers to educate themselves about South Asian experiences with PPD. And so, with these goals in mind, we sought narrative medicine as an ideal platform. Narrative-based medical education embraces the philosophy of teaching about illness through the portrayal of patient stories. Not only does narrative-based medical education increase empathy for the patient experience, but it also improves health equity by bringing awareness to the experiences of individuals from marginalized communities who have historically been understudied. Here we present the development of a culturally rooted medical education tool exploring South Asian narratives about PPD with the purposes of increasing knowledge about the signs and symptoms of PPD, providing resources for individuals with PPD, improving provider understanding of the patient experience, and conveying the cultural context of stigma towards PPD in the South Asian community. For this project, Indian classical dance was chosen as the medium for exploring PPD narratives given its historic roots in storytelling and cultural connection to South Asian narratives. I, along with my colleagues Yamini and Anvita, have been trained in the Indian classical dance styles of Bharatanatyam and Kuchipudi. These dance forms are traditionally used to depict stories from Hindu mythology, but over time have evolved to depict all of the joys and tribulations of the human experience. In order to create a dance film which is representative of the PPD experience and also educational, we gathered information about PPD from symptoms identified in the literature, we collected South Asian narratives about PPD, and we researched evidence-based treatment options. We then choreographed a dance film depicting the story of a South Asian woman's journey through pregnancy, childbirth, her struggles faced during the postpartum period, and her road to seeking help. Our dance film can be viewed through the QR code provided here. We highly encourage you to watch our film, as it will provide you with a more complete understanding of our project and its implications. Once we created this dance film, we hosted a film viewing event for medical students at Boston University. After viewing our film, participants engaged in focus group discussions about their thoughts on the film and what they learned. Participant comments were recorded, transcribed, and coded for emerging themes through in vivo qualitative analysis software. Using applied thematic analysis, we identified 3 overarching themes on the topics of stigma, the utility of narrative medicine, and the role of healthcare providers to learn about the cultural context of stigma. Medical students identified stigma as a barrier to patients being able to seek social, community, and medical support. Interestingly, several discussions also related stigma to the lack of knowledge about PPD and the resources available. Students proposed that stigma hinders conversation, which ultimately makes it more difficult for people to know about the resources and help that they can seek. One action item that emerged in these discussions was that by improving general knowledge about PPD and the resources available for those seeking help, people can feel more empowered to have conversations about PPD and destigmatize this illness. In terms of how our dance film approached the concept of stigma, there was an overarching theme that portraying patient narratives through dance media was effective in destigmatizing taboo medical conditions. Further, students reported that narrative medicine was a useful tool for teaching about various translatable social risk factors that patients may have. Another interesting perspective which emerged on the theme of narrative-based medical education was that emotional connection facilitates learning. An example that a student mentioned was that in the general medical school curriculum, there are resources such as Sketchy Medicine, which use cartoons and visual aids to help students form different memory pathways from the ones that they create from just absorbing lecture materials. In a similar way, the emotional connection that narrative medicine provides also allows for a new type of memory pathway to be formed on a subject and thus enhances learning. Students also shared that the effectiveness of narrative-based medical education lies in the selection of topics it is used to explore. In fact, it could potentially lose its strength if it is applied to all learning topics. Rather, when it is used tastefully in sharing stories from marginalized communities and for teaching about social risk factors, it serves as a very memorable and impactful learning tool. Finally, our participants expressed the importance for healthcare providers to learn about the cultural context of illness and always strive towards improving their cultural competency, as this will have direct impacts on facilitating patient trust, identifying and supporting those at risk, and overall improving health outcomes. Students reported that they felt more aware of the cultural context of PPD in the South Asian community after watching the dance film. A quote from one of our participants, which echoes the sentiment that was shared by students across all 3 focus groups, was that if you understand the cultural context, you can tailor your treatment to that patient. You want to be able to treat the patient, not the disease. In conclusion, our project demonstrates the effectiveness of dance media as a storytelling medium for humanizing stigmatized illnesses, serving as a platform for accessible dissemination of knowledge and resources related to PPD, and allowing for a special focus on the unique barriers and needs that at-risk populations may face. Social and community context can be a challenging social determinant of health to address, given the complexities in qualifying individual support systems and how culture can influence these systems. However, our exploration of dance media as a narrative-based medical education tool demonstrates that even just sharing one story can profoundly influence the way that people perceive and relate to illness. Particularly for marginalized communities, narrative medicine is critical for conveying patient experiences and improving health equity. Thank you.